Hello, Edutainment Studios and Access Healthcare welcome you to Cervical Cancer Prevention Guidelines. This module is part 2 of a 3-part series on the prevention of cervical cancer. The cervix is the lower part of the uterus. Cervical cancer is caused by a virus called HPV. The virus spreads through sexual contact. Sometimes the virus leads to cancer. You're at higher risk if you smoke, have had many children, use birth control pills for a long time, or have HIV infection. Cervical cancer may not cause any symptoms at first. It usually takes several years for normal cells in the cervix to turn into cancer cells. Your healthcare provider can find abnormal cells by doing a Pap test to examine cells from the cervix. You may also have an HPV test. In this course, the objective is to help you know how you're tested for cervical cancer. Cervical cancer is the easiest female cancer to detect early. There are 2 types of screening tests: the Pap test or Pap smear, which looks for precancerous cell changes that could turn into cervical cancer, and the HPV test, which checks for HPV strains that cause precancerous cell changes. The chart shown shows the general screening recommendations from the American Cancer Society. Your doctor may recommend testing more often if you are at high risk of cervical cancer or you have a history of abnormal cervical cells. Work with your doctor to make a cervical cancer screening plan that is right for you. Your doctor will use a plastic or metal tool called a speculum to open your vagina. Then they will use a brush, cotton swab, or a small wooden stick to gently scrape a few cells and mucus from your cervix. These cells are sent to a lab for testing. Pap tests should not be painful, but they can be a little uncomfortable, and you could have spotting afterwards. Your results will be normal, unclear, or abnormal. The chart above shows what each of the results mean. Remember that an abnormal Pap test does not mean you have cancer. It just means your doctor needs to do additional tests to find out what is causing the cell changes. Once you have those results, your doctor can recommend next steps. You may need treatment to remove precancerous cells, or may need to come back for additional testing so your doctor can monitor the cells for changes. The HPV test looks for the high-risk types of HPV that are linked to cancer. Your doctor will take samples of your cervical cells in the same way as your Pap test and send them to a lab. Your test results will be either negative or positive. Negative means that you do not have a type of HPV that causes cancer. Talk to your doctor about when you should schedule your next HPV test. Positive means that you have an HPV type linked to cervical cancer, but it does not mean you have cervical cancer now. Your doctor will consider your Pap test results and suggest what you should do next. If you do not understand the results of your tests or have questions, talk to your doctor about your concerns. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Here are some other sites for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 2 of this 3-part series on the prevention of cervical cancer.